this is an explanation, the theory explanation beside a technique in body therapy called strain counterstrain. And maybe it's my interpretation of the technique. Maybe other therapists do it in a different way. Probably there are other therapists who are doing it in a different way. But I think the beauty of it is you can take technique and mix and blend with other techniques. And this is my interpretation. But before that, let's look at the theory of an injury. Yeah. So and what we can learn from that and what we can do after that to help it. So one way that an injury happens is what we know inflammation. And in inflammation, let's say this is a muscle, the muscle would get inflamed from maybe repetitive strain injury, and the area would be swell, lots of fluid, and painful, and hot because of the extra fluid, and then we will do one technique or certain technique or approaches in massage. Okay? So one way of looking at injury is what we go through inflammation. Now there is another response of the body to injury that end up with a strain or a tear or a spasm that does not end up with inflammation, or the inflammation is secondary. So what would happen into the tissue? You would have, most likely, some kind of a spasm in the muscle. Now, why muscle would be causing spasm? Why the muscle will get into spasm? Any idea?
For oxygen supply.
Oxygen supply.
Calcium.
But what's the first thing that you do when you're injured? You tense. So even before what Jason said happened, there is a tendency of the body to protect itself. Quite cleverly, the body does that, but sending signals from the brain to the muscle, contract and protect. So contraction sees the area from action. Sees that area, it doesn't move. It does not, which is good because you might injure yourself more if it moves. However, there are other things that would happen secondary to the spasm into that area, and that's the reduced blood circulation. A lack of use. No, I don't want to use my neck because I've injured it. So people start to avoid using this area of an injury. And they might use it only now 90% of what they can. And they don't want to go back because they're afraid of overdoing it. How many of you know people who say, no, I can't do that because I have a bad back or my knees? They don't want. Maybe they can do that, but they don't want to because they don't want to get into the risk. That's where psychology also take part of the physiology. If the brain, the master, say don't do it, this area would be neglected. Less blood circulation, tightness. So we're trying to look at how we can improve it. One way, the traditional way, what we learned so far, is that you can do effleurage, improve the circulation, petrissage, yeah? And compression to break, to reduce the tension. There is a new technique that involves also in trying to break the cycle of the injury that called strain and counterstrain. So if we have a strain is just a general name for injury. So an injury and how you counter this injury, how you oppose it. So one way which the strain counterstrain suggests is that if this is the muscle that is injured, you try to find the position that the muscle would be at ease, relaxed more, reduce tension. And so if the muscle is tight this way, you might want to just make it slack and then start working quite softly around it. And what you do here, you get the message into the brain that actually it could be quite nice to do it. It's quite nice to involve that area together. You don't do it in the, oh, I'm going to show you, I'm going to stretch you until you get into the area that, or the position I want. But you do the opposite. It's kind of the calm way to work with. And it's a very smart way because you don't talk only to the muscle, but you talk to the master, you talk to the brain and say, brain, look, I can do that. The muscle is quite relaxed. Would you maybe engage more with this muscle? Maybe it's not that bad. Maybe you can now regain full function in that area. So when you do the technique, yeah, do it gently and talk to the brain really. Talk to the brain and show the brain how you can do it in a relaxed way. Okay, so it's a lot about negotiation here. Like every technique, it's not what we do, but how we do, and the offer we give the body to relax and to say, okay, actually, yeah, I like it. It doesn't feel pain. There is another way of living. Why don't I try to adapt now the nicer way? And I can maybe be more active this way. It's teaching. We are teaching the body to do that. Okay? Any question before we starting to implement it?
Of course.
Yeah.
Of course, the inflammation has ended before to do massage.
Inflammation may or may not occur there. Yeah? So in inflammation, the major way to work with inflammation is try to reduce it in a natural way. So you drain that area, you increase the circulation and drain that area. You allow the arrhythmical movement around it. Remember the oscillation? Mm-hmm. Yeah? These techniques are great for inflammation because it just kind of free the fluid from the inflammation and start moving it by then reducing the inflammation. Okay? So that's another themes of working. We try now something else that involves more talking to the brain. Is it clearer?
No, I was thinking we cannot touch any person with inflammation in progress.
If it's mild inflammation, you can. Okay. If it's not very painful. Yeah.
Just when something's recovering, then it's gone
Yeah.
down a bit.
Yeah. It's not very painful, it's not severely painful, you can work on that. Yeah. So in an acute level, you would leave it. Yeah? We're talking about the level, the severity that you can work on that area. Cool? Let's break that.